In Mexico, the acute lymphoblastic leukemia is the first motive of the cancer in pediatric patients. Unfortunately, the overall survival is very slow compared with the high outcomes countries. Approximately 35% of the old patients have a second relapse, and these patients need obtain or achieve a second remission. The problem is the high toxicity related with the achieved second remission. And the objective of this protocol was evaluate the efficacy and security, the use of the Blinatumomab for the achieved remission and consolidation with haploidentical transplant plus the cyclophosphamide. The advantage of this strategy is that the disponibility to the donor with compared with the non-related donor. So, was the one study with the only one group have received the Blinatumomab for achieve the remission, the conventional dose, and consolidation on one transplant. 74 patients was included in this study, and 75% of the old patients achieved remission with 1 or 2 cycles of the Blinatumomab. 75% of the patients achieved a complete response, and 50% of the patients achieved only a partial response, and 11% of the old patients don't have obtained the response after the 1 or 2 cycles of the Blinatumomab. All patients that achieve remission after the 1 or 2 cycles of the Blinatumomab was sent to the consolidation therapy with haploidentical transplant. These patients achieved over survival approximately to the 70 and 75%, compared with the patients that don't receive bone marrow transplant, and this group unfortunately don't achieve long survival. This group, the survival after the 2 or 3 years following was the 0%. In conclusion, this study showed in Mexican the combination of the Blinatumomab plus haploidentical transplant. It's a very nice strategy for obtaining a good overall survival in the patients with the high risk of the relapse with acute lymphoblastic leukemia, compared with the other strategy in the historical studies that only 15 and 20% of the patients that had received second scheme of the chemotherapy only achieved prolonged remission of the 15%. And in conclusion, this is a good option with the good results for the obtained overall survival superior to the 70%.